much, and I'm really delighted to welcome you to this seminar today on why One Health. And here at LIDC, we have a really deep interest in One Health, both as a paradigm and as a mechanism to support interdisciplinarity. So just a little bit about LIDC. We are a member organization. We have over 5,000 members working across all aspects of global development. We were founded way back in 2008. We're a consortium of 7 University of London institutions. And our goal is to really catalyze interdisciplinary expertise across these 7 institutions. And we're interested in the solution space, or the solutions to the world's most complex and intractable problems. And of course, One Health is part of this solution space. Now, I think that COVID-19 is both an opportunity and a threat to One Health. You know, I think it's safe to say that this interest in spillover zoonotic diseases is probably the highest it's been since the avian flu panzootic way back in 2005. But in some quarters, research in One Health has been it's not accused really, but it's been seen as often being one-dimensional, despite its very, very interdisciplinary pedigree. So as a field, I think it's not the relevance of One Health to zoonosis. I think it's how can we amplify the voice of One Health in these wider global challenges, from climate change to antimicrobial resistance. So we have our MSc One Health students joining us today. So I think this is your challenge in taking this field forward. So we have a fantastic lineup. I'd like to welcome our chair, Professor Sean Clark. Sean is the LSHTM course director for the One Health Masters. And as Shireen mentioned, it's jointly run between the Royal Vet College and the London School. She's the co-director of the London School's Malaria Center. Her research interests include infectious disease epidemiology and public health. Her expertise lies in the development and evaluation of disease control strategies to improve health in resource-constrained environments. She has a specific focus on malaria, but also Sean's been very involved in studies looking at nutritional intervention in children, and it's here that we've discovered her work as part of some of the work that we're doing in the Action Against Stunting Hub. So Sean really epitomizes the wide interests of a One Health practitioner. So welcome, Sean. It's your day.
Thank you, Claire, to that fantastic introduction to what has become a traditional item on the MSc One Health annual agenda, the one half-day event hosted by LIDC, which seeks to highlight all the different interdisciplinary and multi-sectoral research that is happening across the institutions in the Bloomsbury area within the University of London. So going beyond the boundaries of the London School of Hygiene and Tropical Medicine and the Royal Veterinary College, it sort of seeks to expose the MSc students to a whole range of really interesting research. And LIDC has lined up a fantastic set of speakers for us today. And it will be my task to introduce each of those speakers and then leave you to enjoy their talks. So moving on as quickly as we can to allow lots of time for questions afterwards and discussion, I'd like to introduce our first speaker, Dr. George Ludick. George is an educational advisor and chair of the Global One Health Education Task Force for the One Health Commission and of the One Health Initiative. And he's leading on the International One Health for One Planet Education Initiative, which is very appropriately abbreviated to One Hope. He has written widely, and one of his most recent books, Survival, One Health, One Planet, and One Future, is particularly pertinent to the discussions today. And I believe that George will be speaking to us today about the impact of COVID, or the relevance of COVID for our work in One Health. George. if you can take the floor when you're ready. So whilst George is unmuting himself, can I remind everyone to keep your own microphones muted and your videos off during the presentations.
George, Shireen here. I think you had unmuted yourself and then the technology has played a trick on you and remuted you. So please do feel free to start your presentation again, but do remember to click the unmute icon. Perfect, great. Thank you, George. George, I'm so sorry to let you know that the technology gremlins have it in for you today. We know your microphone works because we tested it earlier. Okay. And there we go. If we could just leave it like that, it'd be wonderful.
Sorry about that.
Perfect. Thank you very much.
Anyway, as I was saying, just want to thank Charlene and Claire, Sean, and for inviting me. This is, I guess, it'll be my third or fourth time that I've had the pleasure to be invited to the introductory session for the MSc students, and today I think maybe even to a larger audience. But as Claire was saying, it's about One Health, and it's about One Health and well-being in a COVID-19 world. So to begin with, yes, so the book has been mentioned. So what I hope to do today, in the few minutes that we actually have, is try to answer the question from my point of view in terms of why One Health. And to me, One Health, as my slides go along, will be all about really meeting the United Nations global goals. So there are several key messages, very fast messages, because again, we don't have enough time. I want to talk briefly about the big picture that we're all facing, risks, COVID-19, United Nations development goals, the One Health and Wellbeing concept, global priorities and challenges, and planet sustainability and One Hope. And I think I have one slide that actually gives me, hopefully gives you a bit of hope as well. So that's the overview. To start off with, though, I think it's sometimes really important to think in terms of the big picture, to put things into perspective. So if you think, this is really not going to take more than a few seconds, but basically, I think, you know, most of us know that we've been here for a long time, that atoms and molecules came a bit later, organisms later again, billions of years later. The first energy cell maybe appeared 2 billion years ago. We, human beings, Homo sapiens, appeared maybe 2.5 million years ago, a former form of ours. And it's only 200,000 years that we really became sort of Homo sapiens. And in that period of time, we went through various revolutions: cognitive revolution, agricultural revolution, scientific revolution. Antibiotics, though, when I used to teach students in medical school, they were quite surprised that they only appeared maybe 70 or so years ago. And then, you know, we were sort of engaged with the information revolution. And currently, there's very little doubt with COVID-19, we're really at a point of survival, I think, sustainability revolution. So they're having gone through several evolutions, revolutions, there are certainly risks that the human being has created for this planet. Again, no time to talk more deeply about this, but certainly the Paris Climate Agreement was a good example of the world coming together. However, you know, and the agreement was really all about making sure that the average temperature does not increase by more than 1.5 degrees centigrade above industrial levels. However, having said that, it appears 2 weeks ago that by the United Nations, we have not met any of the targets. in 2020. There are other global risks very quickly. There's population growth, there's the threat of viral outbreaks. Certainly coronavirus is right in there. There'll be more coming, that's what scientists are telling us. AMR, I know that the speaker today will be also talking about that's great. There's certainly a major issue in many countries about the absence of public health systems. And of course, global food security is a major issue for us all, as is the modern lifestyle that we're leading. You know, it's actually quite depressing to say all this, but you know, there are a lot of things that we have to get better, improve upon to sustain this planet and ourselves, including, of course, war, which according to one writer was saying is probably the greatest failure of humanity. And I also put in artificial intelligence, and we may need to deal with this differently than we are today in terms of making sure that humanity continues. COVID-19 is really one of the most important disastrous impacts that human beings have experienced in the last 100 years. But it's more about, according to Richard Horton, whom many of you may know from the Lancet, it's more than just the zoonotic issue, or yeah, as Claire has mentioned, it's really beyond that. It's not, according to Richard Horton, in one of the pieces that he wrote, it's more than it's not only a pandemic, it's a syndemic, because it has such huge social origins. So, well, in the last while, we've gone, in the last few months really, we've gone from the impact of the COVID-19 in January to now, today, as we speak this morning, 38 million cases plus, and there are currently over 1 million deaths globally. The impact has been tremendous in terms of, as I was just saying, cases. You know, the United States leading the way, going up to 8 million. You can add 1 million to all of these figures here. India, Brazil, Russia, and it goes on and on. The impact on poverty is just immense. It's estimated, and I think these figures are actually conservative, but you know, even the first three, East Asia and Pacific, there's a shift towards at least towards 300 million people being impoverished. South Asia as well, Latin America, and the list goes on. I think what these two slides indicate is just the tremendous impact that was unforeseen in the world. The United Nations has been at the forefront, as many of you will know, in terms of responding to the crises that we're facing through the Sustainable Development Goals, which were created in approved September 2015. And the aim of the Sustainable Development Goals is clear, it's direct, and it's critical that we are able to achieve this. The problem, of course, is in the last 5-6 months, we have seen a SDG epochal reversal across all the 16, 17 SDGs. And I think it's shone a light on not only inequality, but it's shone a light on the need for a huge global commitment to new global values, principles, and actions. I think SDGs are excellent, the rhetoric is perfect, but it's putting that into practice that has been very, very difficult. So it's time to stop and think, given all that, and to think more, and it goes back again to what Claire was saying, about the broader issue that One Health and well-being has to deal with. And these are the issues of causation. So the concept is clear as well. I think we've moved in the last 5 to 6 years from One Health and well-being being a movement to an approach, to a philosophy maybe, that's what's coming along. And it really deals with two things. One is the interconnections among humans, animals, plants in a shared environment, and the need for collaboration across sectors, across nations, which we're not seeing enough, obviously. I mean, if you look at the definition, the interconnections, humans, animals, plants in a shared environment, I think, and this may be, I'm not trying to be cynical here, but humans could leave this planet quite nicely and the planet would probably thrive. But the point is, we are here, and it's up to us now to undo so much of the damage that we actually have done to this planet, to the point of now we're now in the sixth extinction phase. The last extinction phase was at the time of the dinosaurs. So it's about sustainability, and it's been taken on board. One Health and Well-being has been taken on board by the World Bank and many, many other organizations, which is actually very, very reassuring. And again, going back to what Claire was saying, it's about understanding that the concept, that the One Health concept, or One Health and Well-being, which I prefer to call it, is actually underpinning every one of these disciplines or professions, or whatever you want to call them. Whether it's economics, political, or whatever, it's all about underpinning each of these and recognizing that they are critical to all of our survival, regardless of how we get there. There are quite a few global priorities that COVID-19 is challenging us with, and there are quite a few challenges as well. Just very briefly, I like what Angelo Gurria, he's the Secretary General of the OECD, said recently in a very short but very important paper. He said, our main priorities have to be income and jobs, but we need to be cognizant of the fact that it's about the well-being goals, that our directions have to be about the well-being goals at their core. It's about equality. Because the individuals, the humans who are really suffering right now, as always, are the ones who are poor, disadvantaged, marginalized. And they're the ones who need the greatest attention that this world has to give. And it's also about making sure that our climate and the biodiversity action and resilience are recognized and prioritized. What are the challenges? One of the biggest challenges, in my mind at least, is what Edward Lucas said several years ago. He said, we need to accept that business and finance are the servants of our civilization and not its masters. And I sort of like that cartoon on the side there. You know, no one is safe if the planet is not safe. And it means a major reorientation in terms of how we look at society, the interplay between the biosphere, society, and the economy. Because now what COVID-19 is saying, it's really the biosphere that is determining what we as a society are able to do and not do. And it's really what we're able to do and not do that should determine the economy, how much money we have. The SDGs are so good, I think, because they speak to all of these, as you can see here. So one of the main steps that Gurria is talking about as well is the need for the circular economy. And again, no time to get into that, but still, but I just may remind you that Sir David Attenborough very recently, last week I think it was, came out with a very short video on tackling plastic waste. And I think that's all behind underpinning the circular economy. So towards a new normal, well, I say new normal because I don't think it's a new normal at all. I don't think the old normal was ever normal anyway. But what the new normal should be about is really understanding the impact of COVID-19 and the importance of making sure that our societies and our workforce become more, get back into action, I guess. So that means new values, knowledge, and competencies. And it also means different types of education and research that is definitely transdisciplinary. And I think lifelong learning is going to be a major factor in our achieving any of the goals. But maybe our greatest challenge, this is really a challenge that I think, I've written several books. This is a challenge that comes out through maybe through all my research, is that basically we need to move from the human centrism concept that we are the most important to an ecocentristic point of view. That is the biggest challenge for all societies, I think. We need to make sure that the needs of our needs fit the needs of our ecosystem, because the other way around just doesn't work. The United Nations is tasked, I think, in the best place to help us get there, because there's so many countries involved. And of course, there are different things that we can do that I've just mentioned very quickly. One of the things is, one of the outcomes of the book that has been mentioned is our propositions for global sustainability. Proposition 7 to me is one of the most important, because it's basically saying that the unifying One Health and Well-being concept should become the cornerstone, if you will, of society, and education systems, all of our education systems. And to this end, we have evolved the One Health Commission, the One Health Initiative, and supporters have evolved a One Hope education initiative. And we're very much in keeping with the Sustainable Development Goal number 17, which is all about partnerships. So we have also are establishing a global external advisory group, which currently has 34 organizations. And what we're trying to do is, in a nutshell, raise awareness of the One Health and Wellbeing concept and the SDGs across global regions, all 6 regions. And secondly, how are we trying to do it through working groups, facilitators, and teams. And so far, we have actually are establishing working groups in Africa, working groups in the Americas. And what we want to do is to develop pilot projects, project proposals with our partners and so on, and to make a difference in the regions in which we're trying to engage and move ahead in these areas. No time for this, but I know it's being recorded. This is the network that we are currently establishing with people. And if anyone is listening here wants to care to join the working groups, the names of the facilitators are listed. Get in touch with them. And it depends on which working group you want to join. And on the right-hand side are other contacts that you might find invaluable. It will be on the recording. We don't have time now, of course, to highlight any of these. So let's move ahead with the last slide. Well, the last slide is really about what I think is a sign of hope. It was, I think, last week that the World Food Programme actually received the Nobel Peace Prize for 2020. I think it's a recognition by the committee that this is, that we are more than politics, that we are all part of the sustainability process. I think recognizing is extremely important, because if you could just consider that in 2019, 2 billion people out of about 7.8 billion did not have access to safe nutrition and sufficient food. That's the equivalent, as somebody was saying, of filling the Wembley Stadium over 22,000 times. Friday this week is World Food Day. So why One Health? Well, I've always been a great admirer of Martin Luther King Jr., but one of the things that he did say is that our lives begin to end the day we become silent about things that matter. And we have a lot of things right now to think about that do matter. And I think the MSc course, as one example, is one area where these types of discussions I've been trying to highlight, hopefully will continue. So thank you very much. Thank you.
Thank you, George. So a real call to action, I think. Yes. We will have a session at the end after all the speakers. We've got 20 minutes for questions. So I encourage everyone to make a note of your questions for George, but we'll move straight on to our next speaker. And we're very pleased to welcome back one of our former MSc One Health alumni, Dr. Praise Adam-Yayo. Praise is a Commonwealth Shared Scholar, a vet, and a graduate of the MSc, as I said. She also recently completed a digital media communications internship with LIDC, during which she researched and wrote on schistosomiasis and stunting for the GCRF Action Against Stunting Hub, which Claire mentioned earlier. And Praise will be sharing with us her experience and her journey as a One Health scholar.
Thank you very much, Sharon, for that introduction. I hope my audio quality is good.
Yes, it's fine.
Okay, yes. So this morning, I'm going to be sharing my experience as a One Health student. And I hope technology is not going to fail me. Yeah, so I'm going to be sharing with us this morning what my background and career path has been like, why I decided to study One Health, my experience being a One Health student at the RBC and LSHTM, and my advice for the new cohort. Yeah, so in 2018, I graduated from the Federal University of Agriculture, Abeokuta in Nigeria. I graduated with a Doctor of Veterinary Medicine degree, and in the same year, I moved on to work in a non-governmental organization that focuses on infectious disease. The organization is called Dr. Ameyo Stella Adadevo Drasa Health Trust. The organization was established in memory of the doctor who lost her life in the process of, trying to curb the spread of Ebola during the 2014 West African outbreak of Ebola. And I joined the organization as a graduate intern and then became the program associate. And, that was actually where I saw that I could actually merge my discipline in veterinary medicine with public health under the One Health concepts. So I resigned in 2019 because I had to move to London for my MSc in One Health. So in 2020, that's like this year, I finished from the RVC and LSHTM just like a month and a half ago. And I also did the communications internship with the LIDC. Yeah, so this is like the most important part of my career path as it relates to One Health. Yeah, so why did I decide to study One Health? And I'm going to be speaking from the perspective of a student and also as a graduate. Yeah, I decided to study One Health, just like I said before, because it's the way to go. So One Health, yes, of course, you're talking about health outcomes in terms of, looking at it holistically from the human, animal, and ecosystem or environment perspective. But in reality, it's actually the way to go, because just like what Dr. George, mentioned during his presentation, we need to move from this sense of anthropocentrism that's focusing so much on humans, the health of humans. We need to start having conversations about the health of animals, how the ecosystem comes to play and all that. So One Health is actually the way to go. And another thing that I realized during the master's program is that One Health would not only sharpen your ability to communicate, collaborate, and cooperate as a student, but even when you start working, you've already set a pace for yourself in terms of being able to communicate, collaborate, and cooperate with people from other disciplines. For example, as a student, I was so excited that we had to take courses from different disciplines. We did some stuff in psychology, some in communication, a little bit of politics and policy, economics, epidemiology and surveillance, infectious diseases, and all that. So it's a very holistic program. And, I think that has a positive implication for work. And if you're talking about achieving the Sustainable Development Goals, of course, Goal 17 talks about partnership. And this is actually the moment for us to start collaborating with people from other disciplines. And of course, One Health graduates are in high demand now because, yeah, like I said, One Health is the way to go. So as a student, yeah, of course, I experienced the culture shock because I had to leave Nigeria and then I had to move to the UK as an international student, but I was able to blend in. And I decided to put the culture shock as the first thing as my experience to encourage international students who are currently on this webinar that you might face challenges, but it's part of life. It's part of the process. Blend in, sharpen your networking skills, and you'll be fine. Again, my class was very diverse. We had people from about 6 countries. I mean, it was really, really diverse. And then, being in class with people from different walks of life, but this should be enough. Like medicine, nursing, veterinary medicine, ecology, and all of that. It was pretty diverse class. And, what that does to you is when your classmates are contributing, they're bringing in different perspectives, and that broadens your horizon, basically. And it's also important that you network with the people in your class, because hopefully your cohort is going to, I have people that would be in supranational organizations like the WHO, the United Nations, or in decision-making bodies like the Public Health England. So it's very important for you to network now. Again, I need to emphasize that the MSc 1Ls course is being taught by two prestigious institutions, the RVC, trading the #1 and #2 positions as the best veterinary school between UC Davis, and of course the LSHTM, which is the #3 public health institution in the world. So I think that is one thing that is a seller if you put it well on your CV. And of course, I need to commend the RVC and the LSHTM because they gave us the best of the best to come teach us. So I can remember, we having somebody from the WHO to come talk to us, people from DEFRA, people from APHA, we went to Public Health England. So we're actually taught by the best of the best. And the academic and non-academic staff were also very supportive. And that's one thing that I think, you should leverage on as a student. And for LSHTM does networking events, by the Career Center and also by the alumni for students. That's one thing you need to tap into because, of course, apart from networking, you also get to know what is happening in the field, how you can get into different sectors, how you can make the best use of your master's degree. And of course, CV writing, review, and job application events. Yes, I would say that my experience at as an MSc 1L student was really interesting. It had its challenges, but if I had to do it again, I would do it all over again. Yes, so I'll just talk about my thesis. So for my project, I worked on schistosomiasis, livestock schistosomiasis, and this is very important for One Health because there are these ambitious goals to, achieve certain things about schistosomiasis, which I'm not going to bore us with, by 2020 and 2025. And it looks like the goals have been too human-centric, but it's not possible for those WHO goals to be achieved if we don't have corresponding interventions for the animal form of the disease. And so what I did with my project was to establish that we need to start treating livestock schistosomiasis. So it's supposed to be a complementary effort, doing the mass drug administration of praziquantel, that's the name of the drug used in treating schistosomiasis in humans, but also treating the disease in animals. Of course, there's the implication of drug misuse and overuse because farmers use the drugs that are meant for humans, in animals. So we need animal formulations of schistosomiasis drugs. And I need to also emphasize on why I was excited about my project. Before I started my project, I made up my mind that I was going to get 2 key skills from my thesis. And the first was I wanted to sharpen my qualitative and quantitative research skills, and which I did. It was intense, but I'm really glad that at the end of the day, I was able to get both. And of course, I wanted to learn more about economic evaluations. I've always been in the science field, veterinary medicine, science. It was so interesting to do something a little bit different. And I did, my project was so centered on something social science based. And I did economic evaluations of livestock schistosomiasis in Senegal. So I'm not going to bore us with this, but this chart is just showing how everything relates to each other, in terms of livestock schistosomiasis, how it's got implications on the health of the animals, on the farmers, and the veterinary sector, on the human health sector, and also on the pharma industry, that's the pharmaceuticals. So, and another thing I did that made my experience as a student to be very interesting and rewarding is that I applied to be a student ambassador for the RVC. And this experience is quite personal for me because, whenever we went for careers fairs, the fact that other Black young women could approach me to say, oh, wow, how old are you? Oh, you're already a doctor of veterinary medicine, you're doing your master's. Oh, okay, interesting. Yes, so tell me more about the school and all that. So it was a very good opportunity to amplify, the work of the RVC, but also to encourage other people that if I can do it, you also can do it. And in conclusion, I would just like to say for this cohort that you should start working on all your assessments, your essays very early. Don't wait till the end. One thing that I realized, for myself is that the essays and the assessments I started working on, quite early. I had better grades in them than those that I waited till the last minute to work on. Okay, and I need to say this over and over again because it's important. You need to network with your classmates. You need to communicate with them often. You need to, build friendships with them. It's okay if some of them don't want to be friendly, but, just try your best in building a solid network with them. And most importantly, never be afraid to ask questions. One thing that I really, really appreciate about the RVC and the LSHTM lecturers is that there's no question that is silly. There is no question that is silly. So if you don't know something, even if it's been said before, never be afraid to ask questions. And what this does to you is that when you start your journey as a One Health professional, well, there's really nothing like that. But when you're using One Health approach in your work, wherever you find yourself, you've built that confidence. It helps you to even be able to talk to people who are not in your discipline, who are not in your field, who are not in your sector, because ultimately the goal is always more important, And I'm going to leave us with this. It's okay not to have everything figured out now. Just carpe diem, which means you should seize the day. Have fun while you're in school, but of course be focused on work. Remember that we are all counting on you. We are all counting on you, so your mental health is very important. We want you to graduate from the RVC and the LSHTM as, ambassadors who will be able to fly high the flag of One Health. And that is what we need right now. So thank you very much. Thanks for having me. And I'm going to hand over to Sean.
Thank you very much, Praise, and also for your reminder to all of us about the importance of social connections. Of course, it's particularly difficult at the current time, but that really is the key to the future. And the relationships built up between the students of today and former alumni, you're going to be the people who realize the vision that George laid out for us earlier. So, just that reminder about not just focusing on the classwork, but also on the networking and the relationships that you can develop in this year ahead. Our third speaker this morning is Dr. Naomi Bull. Naomi is a research fellow at LSHTM, and she encapsulates a multidisciplinary background with experience from veterinary science, infectious disease immunology, vaccine development and public health, and her work across the social and natural sciences. Her main research interests are in interdisciplinary approaches and applying One Health principles to global health challenges. She also works as a policy advisor for the UK government, and she has a keen interest in addressing the challenges of translating basic science into practical and effective policy design. She's a member of the Royal College of Veterinary Surgeons and an ambassador for AMR Insights. And Naomi will be talking to us today about her work in understanding AMR through the lens of One Health. Welcome, Naomi.
Thank you very much, Sean, for that introduction. I will just share my screen now and start my presentation. Okay, so first of all, I'd like to say a very big thank you to the organisers of today for inviting me to come and speak to you about why One Health and why I think that One Health is so important. And I would really like to do this through the lens of my own personal experiences as a research fellow here at LIDC and LSHTM. And one of the topics that I've been working quite a lot on has been antimicrobial resistance. And I hope to persuade you through this, this short presentation that antimicrobial resistance is actually a brilliant example of a global health topic that really does require addressing through this lens of One Health in order to achieve effective solutions and to curb the rise of AMR. So One Health, well, we've had a great introduction to what One Health is and the concepts behind it from everybody who's spoken so far today. But since I'm trying to give you a personal flavour of some of the experiences that I've had working in One Health, I thought I would share with you some images from one of the projects that I've been working on in this area, specifically on AMR. And obviously, we all know that One Health broadly encompasses sort of 3 major areas. And one of these is animal health. So here are some choice photos of some of the animals that I've had the pleasure of working with during my time at LIDC. The project that I'm going to tell you a bit about was working in both India and Kenya. So at the top, you can see some fantastic examples of local Indian breeds of cattle. And then on the bottom left there, you can see an image from Masai Land in Kenya, which operates a pastoralist farming system with herds of animals migrating across the area and congregating together at points like this, a communal water trough. Now, One Health isn't just about animal health, as we know, it's also about human health. So here are some of the fantastic people that I've had the pleasure of meeting during my One Health journey. And the final part, if you like, of the trifecta of One Health is the environment. So here is one of my colleagues collecting a water sample. Again, that's an image from Kenya, a water sample from a local watering hole. Now, I said to you that I hope to talk a bit about AMR and persuade you that AMR is a perfect example of a One Health challenge. For those of you who are not so familiar with AMR, it's actually one of the biggest threats that we face in the 21st century to global health, food security, prosperity, and development generally. And it heavily is linked to several of the SDGs. It's a real global health challenge. It can affect anyone of any age in any country. And my next point is that it can also affect animals. So obviously you can see where I'm going with my One Health angle on this. The reason that AMR is such a problem is that drug-resistant infections...
This is London School of World Economics. I just want to screenshot to ask me later.
So from this one on this platform now.
I'm getting some additional noise through there.
Hello, I'm sorry. Forgive me for interjecting here. This is Shireen, Communications Coordinator, LIDC. Please can I appeal to everyone attending the webinar this morning to keep your microphones and cameras off while our presenters are speaking. Otherwise, the presentations become very disturbed and it's very distracting for those of us trying to follow our speakers. So please do remember to keep your microphones on mute. And thank you, Naomi, for allowing me to remind our audience of this. Please continue.
Thanks, Shireen, that's great. So I was just talking about why AMR is such a problem, and it's the fact that if you have a drug-resistant infection, it's harder to treat. So you'll face higher medical costs, increased hospital stays, and unfortunately also increased deaths. And if you think about this from the perspective of somebody who maybe relies on livestock for their livelihood, obviously that could cause extreme problems in terms of rising levels of poverty, unfortunately. Now, the infographic that I'm sharing with you on the right here is from a review that's a few years old now, but it's still a stark reminder that we absolutely can't forget about the importance of AMR in spite of what else may be going on around the world. And this graphic reminds us that by 2050, if AMR is not tackled and continues to rise at the rate that it's currently rising, we could unfortunately be losing a staggering 1 person every 3 seconds to drug-resistant infections. So again, for those who aren't too familiar with AMR, well, what causes this problem? It's very multifactorial, but at a broad brush sort of level, you know, boiling it down to basic principles, the more we use antimicrobials, the more that resistance has a chance to develop. And that's because every time the microorganism is exposed to the antimicrobial, whether that's a bacteria or a virus or a parasite, it has the opportunity to develop resistance. It has the opportunity to evolve to be able to beat the drug that's being used to kill it. And so because of this, it's really important that one of the key principles of use of antimicrobials is that they must only be used when really necessary. Otherwise, unfortunately, it's running out of effective antimicrobials. And the graph on the right just shows this clear positive correlation between an increased use of antibiotics and an increased development of resistance. So I've talked about use of antibiotics and antimicrobials more generally being really important. How are they used? Well, we know that we use them often for human medicine, but also they are used commonly for animal medicine. And in livestock, antimicrobials are used not necessarily just to treat infection, but also sometimes to prevent disease. And although this is becoming more heavily regulated now, they are sometimes used, antibiotics specifically, to promote growth in animals that are going to be consumed for food. Now, in relative terms, if we think about the absolute amounts of antimicrobial that's used per kilogram of human and per kilogram of animal per year, it's roughly similar. But what we need to remember is that on this planet, there are many, many more animals than people. So actually the total biomass of livestock does exceed that of human biomass. And therefore, actually, it's estimated that about 70 to 80% of total consumption of antibiotics occurs in animals as opposed to humans. And the reason I really want to highlight this is because I'm trying to persuade you that we can't look at one of these sectors in isolation. If we just want to tackle antibiotic use in human medicine and focus on that as a key priority, we're missing maybe 70% of the cause. And similarly, if we just look at the livestock sector, we're missing some key opportunities within the human health sector. So we should really view this as a holistic use rather than separate. And I told you at the beginning, of course, that the environment plays a key role in One Health as well. Well, what am I talking about with that, specifically within the context of AMR? Well, obviously, if we take antibiotics and we give them to our animals, those drugs have to go somewhere. And it's a fact that up to about 80% of the antibiotics that we and our animals consume end up coming out in our urine and feces. And if we think about it within the context of livestock, often livestock dung is used as fertilizer and spread on fields. So if there's antibiotic present in that manure, it can be uptaken by crops and plants, and it can also run off into waterways. And similarly within fish farming, which is a key industry where antibiotics are used at quite high levels, up to 75% of antibiotics used in aquaculture may end up in the surrounding environment. So not only do we need to think about how we're using them when we're giving them to people and to animals, but we really also need to think about the consequences further down the line when those antibiotics are excreted. So I told you I wanted to tell you a little bit about one of the projects that I've been involved in. And as I said, this project was working in India and Kenya with some brilliant local partners, some fantastic local NGOs. And we were collecting data on farmer attitudes and access to antimicrobials, not just for themselves and for their families, but also for their animals. And we were trying to take a One Health approach, thinking about any synergies between those two areas of use. We really wanted to understand people's practices, their attitudes, and what may have changed over time within these communities. And these communities were specifically more smallholder livestock keepers who were keeping a few animals for their own sort of family use or to sell on. But not industrial farming, more of a rural setting. So we held some semi-structured interviews with farmers within these settings and some focus group discussions and community meetings. And of course, not forgetting the environment. There's my colleague who's now turned round to show us the water sample that he was collecting from the watering hole. And we did gather samples of water, soil and feces from across this particular area of Kenya, Kajiado County. And I wanted to give you a flavour of what this environment looks like. And you can see in the middle there, discarded medicine bottles lying on the ground. And I spoke earlier about how within this pastoralist livestock farming system, there's often points of congregation of animals and people around water troughs and around maybe livestock markets. And these may be points of high risk of transmission of resistant bacteria, but also points of potentially high levels of contamination of the environment. I wanted to just share with you some of the One Health issues and the context that emerged from this work. And one of the key things that we came across was that for many of the people that we were speaking to as part of the work, there was quite a serious lack of access to qualified advice. And so that goes across both human health, but also animal health. And it led to some practices that we would consider not best use of antimicrobials. So I've listed their vaccination, but sort of in inverted commas. And the reason I've done that is because vaccination here refers to when farmers would blanket treat their whole herds with antibiotics, for example, because maybe one animal was unwell or their neighbour's animal was unwell, but that's without the advice or input of a qualified professional to advise whether that is necessary or appropriate. One of the other issues that we came across was a lack of understanding of withdrawal periods. So this is, for example, when you treat an animal with antibiotics, you should wait a period of time before drinking the milk or eating the meat from those animals. And again, expiry dates was a concept that wasn't always understood particularly clearly or adhered to. Unregulated access to antimicrobials can be a key issue within certain communities. So the picture on the right there is of an agrovet store in Kenya, and these are livestock drugstores where antibiotics may be available over the counter without prescription. And so they can be used sort of indiscriminately or maybe misused or overused and without much data being available on what's being used and why. And then transmission risk points. At the bottom, there's a picture there of a slaughterhouse. And some of these slaughterhouses may have limited biosecurity facilities. And again, maybe areas where people and animals may congregate, increasing risks of transmission and also potentially environmental contamination. Some of the key challenges we faced during this work was that there may be a lack of understanding of the term antibiotics or antimicrobials amongst the people that we were speaking to. So if taking a tablet, it could be a paracetamol, it could be an antibiotic, but you may not know the difference. Often within smallholder farming systems, there may be limited treatment records, if any at all. And then I've spoken quite a lot today about the Kenyan setting that we were working in with quite remote communities and pastoralist societies. So as people migrate with their animals, it may be tricky to access the right people within those communities to share the correct information that we're gathering as part of the data for the project. I just wanted to share now some highlights from one of the areas that we worked in, so Kajiado in Kenya. And these are some high-level results from our initial work. And we discovered that 76% of people, had never had access to a trained animal healthcare professional, and yet they were purchasing antibiotics frequently for their animals. So on average, about 9 times per year, but some much more frequently. I already mentioned withdrawal periods, and we established that about 64% of people said they were drinking milk and 71% eating meat from animals undergoing treatment with antibiotics. And 35% reported using antibiotics to prevent sickness in their animals rather than to treat infection. So even in this very rural environment with quite disseminated communities, there was still high access to antimicrobials and fairly high levels of use. And so what does this mean for antimicrobial resistance? Well, anecdotally, people did report that antibiotics were working less well than before, and the environmental sampling that I spoke about revealed that antibiotic-resistant bacteria were actually present in 18 out of the 23 sites that we sampled. So absolutely resistance is happening within these communities and people are being exposed to that. Yet levels of awareness of antimicrobial resistance as a problem, as a public health issue, were very low. So having told you all this information, I'd like to bring it back to finish to how can a One Health approach help and how can a One Health approach be part of the solution to tackling the challenge of AMR? Well, I think I've been able to persuade you that looking at just one aspect in isolation, so focusing only on human health, only on animal health, or only on the environmental contamination issues, looking at one of those in isolation really ignores the key interlinkages that occur between all of these different sectors. Unfortunately, as George already mentioned in his presentation, this is now being accepted and adopted at a very high level. So within the UN, the Food and Agriculture Organization, the World Organization for Animal Health and the World Health Organization have come together to form a tripartite to tackle antimicrobial resistance together. And underpinning all of their plans is the need for multi-sectoral cooperation and collaboration. I also wanted to highlight the work of the Fleming Fund, which is a scheme that provides fellowships for professionals working on AMR in different countries around the world. And they offer both human and animal health fellowships. And what's great about this is that it really allows for cross-fertilization of ideas and approaches and learning between these different sectors. So you've not got two arms trying to do things in a different way and not working in collaboration together. So I think there are some great moves forward within this field, and AMR can be used as a good example of where One Health is being adopted and working well. I'd just like to say some very quick thank yous. So to Professor Heffernan, who is the principal investigator on this project, and the fantastic NGOs that we worked with in Kenya, VetWorks East Africa, and in India, which was the Arupa Mission Research Foundation. And ESRC funded this work. And I'm finishing on this picture just because I love it as a quick encapsulation of One Health, because it shows that when humans and animals work together in harmony, you can achieve some quite extraordinary things. So thank you very much for listening, and I will hand now back over to the chair.
Thank you very much, Naomi, and thank you to all of our speakers for keeping fantastically to time. That means that we do have 20 minutes available for questions. So if you would like to ask questions of any of this morning's 3 speakers, do use the raise hand function to put up your hand, indicate you'd like to ask a question. Or if you would like your question read out, then feel free to pop it in the chat. So with that, I'll kind of just open the floor for questions. So remember, don't be shy. As Trey said, there's no such thing as a silly question.
May I please indulge in using what little staff prerogative I have to ask a question of my colleague that I wouldn't normally get a chance to ask? Is that okay?
Yes, that's fine. Is that Sharon?
Irene, yes. So while our audience are getting their questions together, as a Sierra Leonean, you will know that my country, Sierra Leone, was ravaged by the Ebola epidemic around from 2014, 2015, and into in some instances even later than that. And one of the things that has always, as a communications worker, worried me is how we communicate messages about issues like antimicrobial resistance, zoonotic diseases, and so on, to people who haven't had access to digital media and technology and global communications. How do you, particularly you, Naomi, you might be able to speak to this, how do you communicate with farmers in Kenya that doing what they think is the right thing of using antibiotics to prevent disease rather than treat is not the way forward? How do you get those messages across safely, especially in the era of WhatsApp and fake news? Thank you.
Thanks, Shireen. Yeah, you raised some brilliant points there, and it's absolutely true what you said at the end as well, that you have to be so careful that your messaging doesn't end up being damaging, or perhaps becoming the wrong message in spite of your initial intentions. From my own personal experience, one of the things that I can speak to a little bit, and I know you know a little bit about some of the work that we've been doing, is that we, as part of the project I spoke about, worked on creating comic books for school children that shared stories about antimicrobial resistance and how it develops. And sort of the rationale behind this was that children tend to have quite an open mind about things and soak up information, but are also shown to be quite good disseminators of information within their communities. And so we worked quite hard on testing the comic books ideas and stories and the illustrations within focus groups to ensure that they would be a great fit for the context in which they were going to be used. Because you're right, Shireen, that it's no good trying to make a square peg fit in a round hole. It's got to be something that the community can understand and is relevant to their daily settings and their own use. I think, though, in terms of persuading people, particularly within AMR, that it's important to adhere to the principles of good antimicrobial stewardship, one of the things that we found from this project was that even though actually awareness of AMR as a phrase and a concept was limited, anecdotally people were definitely aware that something was changing with the medications that they were using because they were no longer as effective as they had been. And so even though perhaps people didn't understand the reasons for that, or they thought it was a problem with the manufacturer or some other issue, if you can share information in a way that's accessible to people so that they understand that the issues that they've been having are in fact related to that particular problem of AMR, that then I think does gain quite a lot of traction within communities, because it's a problem that they now feel that they have some ownership, and that may make your communication of that challenge more sustainable. Hope that gives some idea, Shireen.
Thanks, Naomi. Emma, I see that you've got your hand up. Do you want to unmute yourself and ask your question?
Yes, hi. Thank you so much for that really engaging talk, everyone. I would just like to ask, maybe this is a question for George. The concept of One Health, and although people have been working within a One Health perspective for so long, is really parallel to a lot of the ways that indigenous cosmologies already function, of having a human-animal ecosystem interface that's completely blurred and interdependent. And I was wondering what work One Health does to learn from indigenous communities and to learn from alternative knowledge production systems. And yeah, if any of you have insights as to groups working with indigenous communities. Thank you.
Yes, hello, hi there. Right, as well as you're speaking, as was already mentioned with AMR and Naomi and so on, several things came to mind. I'll be very quick. Something that really does trouble me a lot in the last few years, especially with Ebola coming along. I think with Ebola, we had about 13,000 people who died in Sierra Leone. And when you talk about indigenous communities, I worked in Northern Ontario with the Native Cree at that time when I was setting up training programs and so on and so forth. And one thing that continues to trouble me in different parts of the world now, especially because democracy is on a decline. We only have 5.9% of the countries currently that are now classified as fully democratic. Blah blah blah. So these are all issues that are extraneous to, but directly linked to the issues that we're facing. And Sierra Leone, Ebola is a good example. Again, here we have an example of a major problem, a major number of people dying. The socio-economic political action that was necessary then was certainly put in place after a lot of stalling and so on. And there were some issues raised and problems solved. However, it seems to me, I think I have not been there for some time, but it seems to me that few things have changed in Sierra Leone since the Ebola crisis. And I can think of the same thing in many other nations in India, provinces in India and so on. So the question is, COVID-19 is a wake-up call and should be shaking the world really, really strongly right now, because it'll only take one individual to, acquire another, maybe SARS-related illness, and spread it through the rest of the world. Now, my question is this: it's also for the business world, for the political world, and so on. Why are they not taking it on board as seriously as they ought to? Because because basically the planet is at stake, and if we keep on putting our heads in the sands, I think we're not going to resolve anything. In terms of this particular communities, I would like to see MSc students, once they graduate, maybe playing a much bigger role in raising awareness of what Naomi was talking about and so on, in terms of and how to look at some of the issues, in particular getting in touch with decision makers in some of these countries. And calling meetings together and so on and so forth, as again Naomi has talked about with focus groups and so on. So it's a bigger issue, and the forces of the world are really impinging upon what happens in local communities. And until we sort of get into those forces of the world, United Nations, WHO, and so on and so forth, and bring them to the local communities and raise awareness of what's really going on, I think nothing will change. But it's time now, definitely. COVID-19 is an excellent example where we need to really think like this. Bring the world to the people, rather than people to the world. Thank you.
So Aoife, I think you have
Thank
a
you so
question
much
too.
for that response.
Hi, yeah, I do. Good morning, everyone. I have actually a couple of questions for Naomi, if that's okay. So I just wondered if there was any kind of specific work being done in Kenya as looking at the level of antimicrobial resistance in milk in kind of the specifically like the urban kind of small scale dairy farms. And also, was there any kind of organizations looking at the intervention at the level of the agri-vets themselves, like the vet technicians that are dispensing the antibiotics? And I think generally they are vet technicians, but I don't think they have much interaction with the people they're kind of dispensing these meds to, and whether or not that would make a difference in terms of education. Thank you.
Thanks, Aoife. Yeah, these are great questions. One of the things I can talk a little bit about is I mentioned at the end the Fleming Fund. And so I'm actually a mentor for one of the Fleming Fellowship cohort in Kenya at the moment. And they are hosted through LSHTM, which is an absolutely brilliant link. And they're a great cohort of really people in the right place to make a difference. Another way, again, I think that we can really effectively use awareness raising through this brilliant network of professionals within the right organisations to make a difference. So certainly during my interactions with them, I'm aware that there are fellows that work on use and resistance and surveillance, and the animal health resistance fellow, certainly her laboratory does do testing of some residues and also some sort of sensitivity testing of bacteria from infections. I would say generally as a service within the animal health sector of Kenya, it's not so robust and it's not so well uptaken, but part of the work that she really wants to do is encouraging farmers to use that service more and encouraging animal health professionals to make farmers aware that service exists. In research terms, yes, there are some researchers working on it, but I would say it's more of a research level. It's more of a sort of a targeted look at a specific sector rather than sort of knowing what's happening more broadly across the country. And then there's a second part to your question as well. I'm sorry, it's just escaped me. Go on, prompt me.
Sorry, no, I was just wondering if there was any kind of organizations working with the agri-vets themselves, the vet technicians that dispense the meds. And
yeah, that's a great question, and it's absolutely key as well to it's key to changing attitudes, but also, I mean, I think this is one of the ways that AMR is such an interesting conundrum, because it presents many, you could call them conflicts of interest in a sort of a broad sense, I suppose. But these are people's livelihoods as well as medicine sellers. So is there a solution to be found there in upskilling and retraining and having more of a community animal healthcare worker cohort of people who have a higher level of training and can provide advice as well as just sales? In terms of organisations working with them, there are some NGOs within Kenya that work in this area, and similarly again the Fleming Fellows are planning to do some outreach work where they will provide some awareness raising sort of sessions and some educational sessions, and we hope that through the course of the fellowship stronger links will be built with, for instance, the Veterinary Medicines Directorate of Kenya and then the more informal pharmaceutical sector. So I think through building those channels of communication, hopefully that opens up a better dialogue and things may change slightly in the future. But yeah, hopefully that gives an idea.
Thank you.
If I can also chip in there, our work in Uganda, where we also looked at the medicine sellers in the human and veterinary sector, quite often, because veterinary services are relatively thin on the ground in many low-income countries, the drug sellers in the agro-vet shops were quite often coming from a background in animal production, so maybe they had a diploma in animal production. So linking back to what George was saying earlier, I think it's about influencing the education curriculum of the people that will end up working in that sector, and that's something we can do in terms of awareness building as well. And then we have a question from Irene Nager. Irene, welcome to the webinar. Do you want to switch on your mic and ask your question?
Okay, thank you so much, everyone, for your presentations. My name is Irene again. My question is to George. regarding workforce development. I work for the Africa One Health University Network, and I liked his discussion on the new normal, and for us getting new values, new knowledge, new competencies. Can you throw more light, try to unpack some of those new values? Because we're at a point where institutions, academic institutions, actually struggling to open. What are some of those new values that innovations within this post-COVID context that we should be looking at as academic institutions? Thank you.
Well, thank you very much, Irene. I've been actually interesting to see you there because I've been trying to get in touch with you about something totally different, but it's good to see you. Okay, having said that, new values, well, basically, yes, the old normal, our normal that we think existed was really never normal. It was never normal to have a world, and this is where my not cynicism, but my reality comes in. It was never normal in a world to have 5 billion people living, not benefiting from the benefits of the earth, not benefiting from the bounties of the earth. It was never normal. It was never normal that 1% of the global population owns close to 50% of the global wealth. It was never normal. It was never normal that young people in school system in the United Kingdom, in the United States, in the what we call the not have not, but have countries, are starving, are hungry. It was never normal. I can go on and on, but it was never normal. Racism is not normal. It's not normal for human beings to even think like that. By all means, we all come from the same stock. And it was never normal what's going on in different countries, So what values? Well, I think values of democracy, that it's better to have people.
George, you seem to have muted yourself. I'm not sure what happened.
I'm not just sure. Maybe somebody was trying to tell me something there. But I mean, it's more normal to collaborate than to compete. Our educational system is a very good example of that. Our educational system grew out of the 19th century, and it became a hierarchical system. Principals at the top, students are at the bottom, and unfortunately, in many ways, in some countries especially, they are still at the bottom. And so, and we sort of developed educational psychologies that are based on collaboration, on Skinnerian psychology to a large extent, classical learning, it's very much stimulus, response, reward, But we're still running educational systems that prize the values of competition, of elitism, of a lot of these things. And I think we have to change how not only what we teach, but how we teach it and what we model to our students. And I'm afraid to say it's not the students who are motivated to go to class every day and they want to get there, it's because there's something there that they don't have. But it's not necessarily memorizing information or facts. We've got to get them engaged in the learning process so that they also discuss with each other, with the teachers and so on, about things that matter to them. So the fragmentation, I think what I'm really saying is, if you go to Canada, United States, Kingdom, or Uganda, I would say that 99% of the classes are fragmented according to courses. Mathematics, English, science, whatever. And the students then graduate and they say, how does this all fit together? Well, the United Nations Sustainable Development Goals have made it very clear that everything is interconnected. And we now have to start. But above all this, I think it's kindness and compassion that we need to bring into the system. I think that's fundamental, which means our curriculum has to change. And our curriculum has to give us you know, the possibility that there is definitely hope rather than despair. I don't see that happening. And that's where I think our project, One Hope, might make a difference in primary schools, secondary schools, tertiary education. We have to start linking all the different things that matter to students and to their parents and the communities. We have to link these for them, with them, but not to keep everything in different boxes and create silos. So I'm not sure if it answers any of your questions, but off the top of my head, you know, all our values have to change, basically. Our assumptions about who we are, why we are, and where we want to go. All that has to change. Thank you.
Thank you, George. Thanks.
So we will be closing this open session soon, before we go on to a closed session with the MSc student, the current MSc students. So if anyone has any final comments or questions for any of the speakers, do raise your hand now or type your question in the chat. And I'd also like to say, Gun or Sharon, do you want to say something about how people can stay in contact with LIDC?
Thank you very much for this opportunity, Sean. Yes, I would. You can go to the World Wide Web and search for LIDC, and please make sure if you're looking for us for one of our other platforms such as YouTube or Twitter or whatever, that you look for the London International Development Centre, because as I found to my great amusement, there is another organisation with our initials, which is the Leeward Islands Debating Competition. We are not them. We do debate, but we don't have competitions such as that. So our Twitter handle is at LIDC_UK. You can, of course, go to our website and you can send emails to admin@lidc.ac.uk. If you have queries about LIDC membership, we now have categories of membership outside of our core member institutions. So if you happen to work for or study independently and you're not in an LIDC member institution, we've now made it possible for you to join LIDC and take advantage of our membership benefits. Check out our website for this and for news of this and other events. We do post recordings of past webinars which have covered everything from racism and global development to the impact of religion on COVID health messaging. And as you may know, if you are in an LIDC member organisation, you can apply for an internship with us. There is a closed session following this webinar, which is for those on the LSHTM RVC One Health course only. We do have a list of students who will be admitted to that. So for those of you who are not on the MSc One Health, this is a great opportunity, as our chair has said, for you to ask your question if you have one. Otherwise, we will be closing this link in approximately 2 minutes with the chair's permission. So I'll leave it there for now, but yes, do keep in touch with us via Facebook, LinkedIn, Twitter. Check out our YouTube channel, check out our website. Thank you very much for your attendance this morning. It means a lot.
Thank you, Shireen. So we do actually have a question from Samuel Akpan, who has a request for George, saying that Samuel would love to know more about Project One Hope, which you just mentioned. And George, could you give us some information about how the audience can find out more about that program and how they can engage?
Yes, the last slide in the of the slide presentation that I made, the last slide was probably too fast, but lists the various facilitators and names of facilitators of One Hope and also organizations. As I was saying in in that portion of the discussion is that we currently have projects going in Africa, in primary education, secondary education, in civil society and community, and in excuse me, basically in those two areas. And it's the same thing we have going in the Americas. One Health is One Hope is really about trying, again, in my own words, is trying to advance or progress the concept of the of One Health and well-being. I use the word well-being because if you talk to most people and say, what do you think One Health is? They say, well, immediately goes down to, well, it's all about humans, aren't we? I mean, yes, it's very important that we have mental health, that we have physical health, but it's much more than that, isn't it? So we added the term well-being a couple of years ago in some of the communication, simply to say there are some conditions that apply to both people and the planet. The planet is organic. The planet also needs to be healthy, and it also has to have well-being concept. So it's about progressing the One Health and well-being concept and the SDGs across the regions, which means the schools, which means corporations, which means government, NGOs, and the communities, really. And how do we do that? Well, it's basically, again, we have these working groups going on in these regions right now. Some are just starting. If you're interested in joining a group, what I suggest you may want to think about is to look at the names at the end of the slides, get in touch with the facilitator for the group that you may want to be involved with, engage with, and the country, the region, and send them an email, say, I'd like to be part of the working group. You know, and then immediately I'm sure he or she will say, come on board, our next meeting is such and such. We're meeting online for an hour every 4 or 5 weeks, but in the meantime, we can share some information and so on and so forth. That's very easily done. And we really need, one of our main concerns is with the One Hope project is really trying to get a regional representation from different parts of the region to join the working groups. We only have a few working groups going, so we need to make sure that people there. And secondly, is we need your ideas, because really it's all about the things that have been discussed today that should be talked about, many of them by the working groups. But do get involved, and if you want to send me an email, anyone listening here, send an email how you get some more information on One Hope or whatever. I'll be happy to respond immediately or within the next few minutes or a few hours, I should say. Sorry. Thank you.
George, if there's a website or an email that people could contact you on, could you just type that into the chat, perhaps?
Yeah, no, it's gladiki@aol.com. If you know how to spell Ladiki, you're well on your way. People are trying to understand that, but no, it's gladiki. Again, it's on the last page of the slides, the last slide, that the name is spelled out and so on. And it's there. Yeah, I really do think that One Hope is a way forward. I am delighted that so many organizations, I think there are 34 major organizations so far, including RVC, including the London Tropical Medicine Group and so on, have agreed to join and support the concept. It's, but what we're trying to do again is to have the working groups create projects, talk about priorities and so on in each of the regions, and maybe come up with 1 or 2 good ideas this year, next year, to say, well, can we get some funding for this project? Who? By whom? From whom? Don't know. There are no guarantees. But the point is, if it's based on evidence, if it's based on the things that I've heard today, for example, in Kenya and India and so on and so forth, where there are some real serious needs, I couldn't agree with more than with Naomi about AMR. AMR could very well become the next COVID. It really can, and wipe out a lot of civilization, I think, as well. So it's so urgent to get funding. How do we stop this? And it's through education, really, not necessarily formal education. It's really non-formal education in the community and so on that can make all the difference. If you bring in credible people from the community who should share these concerns, not outsiders coming in saying, I'm a consultant. People don't need that, but they do need their own knowledge base, their own people that they have credibility in to do this type of talking discussion. I think it's very, very important. You know, so One Hope is really a localized attempt. It's not a top-down thing at all. Support from myself and colleagues and so on to support these type of thinking. But the ball has to roll in their court, in the region's court, in the court of the regions, you know, not outside. Yeah. So I mean, you know, I'm not sure if you know, but I'm happy to answer questions, respond to emails if you want to discuss anything with me. Yeah. So what I can say at the time that I have and you have actually.
So at this point, we shall draw the first session this morning to a close. I'd like to thank all three of our speakers. We greatly appreciate your contributions and the thoughts that you shared with us this morning. We got some fantastic comments coming in from the audience who've also highly appreciated that. So I'd like to draw things to a close and just acknowledge and thank our speakers. Thank you very much. Sharon, would you just like to have a quick word about how the students reconnect to the next session?
Indeed, thank you. As I mentioned earlier, we do have a list of the MSc One Health students who will be participating in the second session. As per the email that you should have received, we'll be using the same link. We will be monitoring attendance because this next session is internal only for the MSc One Health students. So I would like to take this opportunity, as has our chair this morning, to thank you all for your participation this morning. I'm sure you'd found the event as interesting and informative as we have done. We're very grateful for your participation, but please only rejoin the second session in 5 minutes time, 11:35, if you are a participant or staff member on the MSc One Health. We'd really appreciate your cooperation with that. And thanks again for your participation this morning. I'm about to end this meeting now, so I'll thank you again. And please do keep in touch with us via our platforms, Facebook, LinkedIn, YouTube, and particularly Twitter. We tweet at LIDC_UK. Thank you and have a good rest of the day. MSc One Health, we'll see you in 5 minutes.